Self-massage Achilles tendon. You can massage the affected area using your thumbs. Just apply enough pressure to feel an effect without creating too much pain. Be sensible. If it feels like you're pressing too hard, then you probably are. You should massage the affected area and the area surrounding it for between 1 and 20 minutes, and repeat this up to 3 times per day. In some cases, people may feel pain even with a light touch. If this is the case, then you should consider doing an ice massage instead. Ice massage Achilles tendon. A combination of ice and massage is often the most effective approach. Begin by applying massage cream to the affected area. People often use aqueous cream, E45, and even natural oils like sunflower or olive oil, but you can use anything you like, as long as you're not allergic to it. The massage cream will help the cube to move around and stop it from sticking to your skin. Next, take an ice cube and hold it in a tissue. This will stop it from sticking to your fingers. You may have to start the massage gently so that you don't elicit too much pain, but as the ice numbs the pain, you can increase the pressure for a deeper massage. You may perform this for up to 5 minutes and repeat up to 5 times per day. Gastrocnemius stretch. This is a good exercise to reduce morning stiffness. Begin by standing by a wall and leaning against it with your hands. Next, pull your tight Achilles back and keep your knee straight. Place your other leg nearer to the wall and bend your knee. Remember to keep your back leg straight at all times and your heel on the floor. Lean forwards to feel the stretch in your back leg. Hold the stretch for 30 seconds and then relax. Repeat this 5 times. You may perform the exercise 5 times per day. It is best performed first thing in the morning and last thing before bed. Soleus stretch. Begin by standing in a step standing position. The toes of the affected leg should be at the heel of your other leg. Now bend both knees, keeping your heels on the floor at all times, until you feel the stretch in the affected leg. Hold the stretch for 30 seconds, relax, and repeat this 5 times. You may perform the exercise 5 times a day. Like the previous exercise, it's best to do first thing in the morning and last thing at night. Resisted exercises Achilles tendon, mid-level. Eccentric step exercise Achilles. For this exercise, you'll be using the bottom step. Stand with the heels of your feet just off the step. Now raise yourself up, using your good leg, until you're on your tiptoes. Always use your good leg in the lifting phase, not your affected leg. Next, slowly lower both heels back down. This should take about 4 seconds. Keep the tension in both legs, but use your bad leg as much as you can without increasing your pain. You can use your good leg to take as much of the weight as you need in the lowering phase. As you get stronger, let your affected leg do more of the work. You should aim for this leg to do all of the work in the lowering phase eventually. Relax and repeat this between 15 and 80 times. The more repetitions you do, the harder the exercise will be. Rest for 30 seconds and perform the repetitions at least 3 and up to 12 times. Again, the more you do, the harder it will be. You should repeat this exercise daily until your symptoms subside. Note that most runners will need to be able to perform 80 repetitions 4 times per day before they can return to running. Some studies have shown that this exercise can even be performed if it's painful, but use your common sense. Generally, if you do push into pain, up to a 4 out of 10 on the pain scale during the exercise is okay. But if it's more painful than a 4 out of 10 or more painful the next day, then it's too much. Symptoms normally subside after 12 weeks of performing the exercise. If your symptoms return, start the exercise again. Achilles tendon, advanced level. Achilles band exercises. For this exercise, you'll need a flexible rubber band. These can be purchased for under £5 per metre from many retailers. Choose a resistance that you can actually perform with. Remember that the exercise only works if you can move your foot. It's also important that you choose a band that doesn't cause you pain. Begin by holding the resistance band in your hands and hooking it around your affected foot. Pull your foot all the way up towards you. Now press the foot slowly down to point your toes to the count of 2 seconds, and then slowly return your foot to the starting position to the count of 4. Relax and repeat this 5 times. Rest for 30 seconds and perform the repetitions 3 to 5 times. The more you do, the harder the exercise will be. Repeat this daily until your symptoms subside.